She was caught on camera drinking from a blood bag. Not just one, but 3 of them. The hospital's security footage showed her in the storage room, her back to the camera, holding a full 4 bag to her lips. She tilted her head back and swallowed like someone drinking cold water on a hot afternoon. The first bag emptied. Then the second. By the third, her hands were shaking. When the hospital director played the footage in the staff meeting the next morning, nobody spoke. The room was dead silent except for the soft hum of the air conditioner. And then someone whispered, "I knew it." Subscribe to my channel, like this video and comment where you're watching from. St. Michael's Hospital in Lagos was always full. It wasn't the biggest hospital, but it was one of the cheapest, so people from all over the city came for treatment. Some patients got better. Some didn't. That was normal. But lately, something strange was happening. Patients who came in with minor illnesses, malaria, typhoid, infections, were suddenly going into shock. Their bodies went cold. Their breathing slowed. Some of them died, and no one could explain why. It wasn't until one of the younger nurses noticed something odd that people started asking questions. "Nurse Chinyere," she whispered to another nurse during a night shift. "She's always in the supply room. But she never comes out with anything." At first, they brushed it off. Maybe she was taking a break. Maybe she needed a quiet place to rest her legs. But then, more nurses started noticing it too. And then a doctor, Dr. Yusuf, started checking patient records. 3 patients in the last month had died unexpectedly. They all had one thing in common. Nurse Chinyere was the last person who attended to them. Chinyere was a quiet woman. She had been working at the hospital for almost a year, and nobody really knew much about her. She didn't gossip with the other nurses. She didn't talk about her family. She worked her shifts, did her job, and went home. She was always calm, always composed. But when Dr. Yusuf started looking into her, he realized something chilling. Whenever Chinyere was on duty, blood bags would go missing. At first, it was just 1 or 2 every few weeks. But then it became 3, 5, 7. The hospital kept a strict log of every blood transfusion, and yet, some units were disappearing without any record of use. One night, Dr. Yusuf decided to check the storage room himself. He waited until midnight when the hospital was quiet. The security guard at the front barely looked up as he walked past. When he reached the supply room, he stood outside, listening. Silence. Then, a soft rustling sound. His heart pounded as he turned the handle and pushed the door open. Inside, standing in the dim glow of the refrigerator light, was Chinyere. A blood bag was in her hands, pressed against her lips. She was drinking it. Dr. Yusuf froze. For a second, he thought his eyes were playing tricks on him. But then Chinyere turned her head slowly, and he saw the dark red stain on her lips. She didn't look shocked. She didn't look scared. She just stared at him with empty eyes, like she was waiting for him to say something. What are you doing?" His voice was barely above a whisper. Chinyere wiped her mouth with the back of her hand and took a step forward. "You shouldn't be here, doctor," she said. Her voice was calm. Too calm. Dr. Yusuf backed out of the room and hurried down the hall, his hands shaking. He didn't stop until he reached the director's office. "We have a problem," he gasped. The next morning, the hospital director called for an emergency meeting. The security footage was pulled. Every nurse and doctor was told to gather in the conference room. And then they played the video. Chinyere stood in the middle of the supply room, blood bags in her hands. One by one, she drank from them like they were juice packs. No one spoke. Then someone whispered, "I knew it." It was one of the older nurses. She sat at the back of the room, her hands clenched together. "What do you mean?" the director asked. The nurse hesitated. Then she said, "I've seen her do it before." Everyone turned to look at her. 3 months ago, she continued, her voice barely above a whisper. "I walked in on her late at night. She was drinking from a blood bag. I thought I was imagining things. She looked at me and smiled. Then she said, "It's for my health." The room went cold. Security was called immediately. When they went to find Chinyere, she was gone. Her locker was empty. Her ID badge was on the floor of the nurse's station. But there was no trace of her anywhere in the hospital. The security guards checked the cameras, but there was nothing. The footage from that morning showed her walking into the hospital. But there was no footage of her leaving. It was like she had vanished into thin air. The police were called, but they found nothing. No family records. No home address. No employment history before St. Michael's. It was as if Chinyere had never existed. After that day, nobody spoke of her again. The hospital director told everyone to forget it, to move on. But some of the older staff still whispered about her. Some said she wasn't human. Some said she was a witch. Some said she had been drinking blood for years, feeding off patients, making them weaker, pushing them closer to death. And some believed she never really left. Because sometimes, late at night, nurses would hear footsteps in the hallways. And when they checked the supply room, the refrigerator door would be open. And 1 or 2 blood bags would be missing. Subscribe to my channel for more stories like this.